Continuing with Chapter 2, Objective 5, we're going to define, pronounce, and spell complementary terms related to body structure, color, and oncology. So what does complementary mean? Basically, it just further describes the picture of what is wrong with the patient. It could describe a sign, a symptom, a specialty, and other related words to that specific body system. So first of all, what's a sign and symptom? So a sign is objective information and is detected on physical examination, such as observation that the patient has cyanosis of the nail beds. There's a picture of it on figure 2.3 in your textbook, so the doctor can see with his eyes that the patient's nail beds are a blue color. Now, a symptom is subjective and is evidence of disease perceived by the patient, such as stating the feeling of pain in the chest while walking. So a symptom is usually the chief complaint, why the patient is coming in today, and it's usually in their own words. So headache, chest pain, those layman's terms that we talked about earlier. So our first table are complementary terms built from word parts. So they could have a prefix, suffix, word root, combining vowel, or a combination of all of them. So again, don't focus on the long word, break them down into word parts to learn these words. Cancerous, pertaining to cancer. Carcinogen, substance that causes cancer. Carcinogenic, producing cancer. Cyanosis, abnormal condition of blue. Diagnosis, state of complete knowledge. And again, the abbreviation is capital D, lowercase x. Etiology, study of causes of diseases. Iatrogenic, produced by a physician. Iatrology, study of medicine. Metastasis, beyond control. Now, right below it says PL, which means plural. So the plural term is metastases. And then the abbreviation is METS, capital METS. Oncogenic, causing tumors. Oncologist, physician who studies and treats malignant tumors. Oncology, study of tumors. Organic, producing to an organ. Pathogenic, producing disease. Pathologist, physician who studies diseases. Pathology is the study of disease. Prognosis, state of before knowledge, and abbreviated capital P, letter lowercase x. So again, on your homework, make sure you are typing them correctly. So a lowercase p, lowercase x would be incorrect. So capital P. Xanthochromic, pertaining to yellow color. Xanthosis, abnormal condition of yellow. Then the next few pages of your textbooks have lots of exercises. Again, best way to fully understand these terms is by doing the practice work. Okay, now we have complementary terms not built from word parts. So they will not have a prefix, suffix, word root. These you're just going to have to memorize, unfortunately. Hopefully most of these you've at least heard of before, but again, it's just going to take you a little bit more time to fully understand these definitions. So let's go over these complementary not built from word parts. Afebrile, without fever. Apoptosis, programmed cell death, a mechanism for cell deletion to regulate cell population or destroy damaged or defective cells. Benign, not malignant, non-recurrent, favorable for recovery. So if you're going to get a cancer, having benign cancer is the good type. Biological therapy, treatment of cancer with biological response modifiers that work with the immune system, also called biotherapy or immunotherapy. Carcinoma in situ, cancer in the early stage before invading surrounding tissue. Chemotherapy, treatment of cancer with drugs, it's abbreviated as just chemo. Encapsulated, enclosed within a capsule, as with benign or malignant tumors that have not spread beyond the capsule of the organ in which it originated or started. Exacerbation, increase in the severity of a disease or its symptoms. Febrile is having a fever. Hospice provides palliative or supportive care for terminally ill patients and their families. So hospice is when the doctor says the patient has 6 months or less to live. Hospice can be done at a hospice location or in the patient's home. And basically, they're no longer trying to cure the disease. They're basically just giving them comfort. So more morphine so they don't have pain, things like that. They're just making the patient more comfortable, and they're getting the family ready for once the patient dies. Idiopathic, pertaining to disease of unknown origin. So just think of an idiot doesn't know anything. Idiopathic is unknown origin. They don't know where it started. Inflammation, localized protective response to injury or tissue destruction characterized by redness, swelling, heat, or pain. In vitro, outside the body or in a lab setting. In vivo, within the living body. Malignant, tending to become progressively worse and to cause death, as in cancer. So again, this would be opposite of a benign cancer. A malignant cancer is the bad type. It doesn't mean it can't be cured, it's just going to be more aggressive. Morbidity, state of being diseased, incidence of illness in a population. Mortality, state of being mortal or death, incidence of the number of deaths in a population. Palliative, providing relief but not a cure. So during hospice care, the nurses and doctors are providing palliative care. They're just providing relief and comfort to that patient. They're not trying to cure the disease anymore. It's too late for that. Radiation therapy, abbreviated capital XRT, treatment of cancer with a radioactive substance. Remission, improvement or absence of signs of a disease. So basically the cancer is, I don't want to say cured, but it's in remission, meaning it's no longer identifiable. Then the book gives you some more information about hospice and palliative care, and also about the different cancer therapies. So again, it's a great way to learn more information, but I really won't test you on the cancer therapies or the detailed information on hospice or palliative care. And that will, nope, one more slide, I'm sorry. So, which of the following terms is built from word parts and can be literally translated to find its meaning? So, in vitro, is that built from word parts, prefix, suffix, word root? Hopefully you said no. What about carcinoma in situ? That is also not built from word parts. Carcinoma is, but the in situ part is not. So that is not built from word parts. What about adenocarcinoma? Well, that one does have prefix, suffix, word root. Your oma is your suffix, your adeno, or just adden, is your word root, /o is your combining vowel, which makes your combining form, and then carcin would be your other word root. And then benign is not built from word parts either, so your answer should be C there. And that will end